All right, Brian, if you'll tell me a little bit about the healthcare industry locally here and what you
Sure,
think about
Eric.
it.
Well, I've had Kaiser Insurance ever since we moved out from Minnesota in 1962, and it's a great healthcare program. Problem with it is every year the costs go up exponentially, it seems, maybe 10 to 15 to 20% a year in costs. And to the point where my wife and I now pay $831 a month for health care. And
$831 a month.
a month.
How do you afford that?
Well, you work harder. I'm at a commission sales, so you just try to make more sales. But that's up 20% over what it was a year ago.
And you work in the insurance industry, so you know about these things.
Right, yeah. And the challenge is that it's hard to know. Most industries have to be competitive with others in the industry to competition's good is what I'm saying is car dealers have to price their product right in order to sell their models.
Mm-hmm.
If they don't price it right, they're not selling the models, and another manufacturer will sell. But it seems universally healthcare providers get together and decide among themselves what the price increases will be, and I can't see how everyone would be impacted that same way. I think too there's a lot of cost differences with drugs, for instance. We in America pay a lot more for the same drug than you would if you went across the border to Canada or Mexico.
Why is
the
that?
Same exact drug. I think it's priced to the market and what the market will bear. As an example, gasoline prices are at pretty much historic all-time highs.
Mm-hmm.
We have lots of refineries here locally in California, yet we pay much higher than most of America for our gasoline. They can produce it here and truck it all the way to Kansas, as an example, and sell it for $1 less a gallon. Why is that?
Yeah.
When I was in the service, I was stationed for part of the time in New Mexico, where all the cattle herds are, and we paid more for steak there than they did in Chicago, where they had to ship all the cows too. So it's manipulative is what I'm saying. I don't think there's any, like, I'm in the insurance industry, and when we have a rate increase or decrease, we have to present that to the Department of Insurance, and it has to be pre-approved. We can't just raise rates or lower rates indiscriminately. It has to be pre-approved. And I think that's one thing that's missing with the healthcare industry right now. There's really no oversight. When they decide together that they're going to raise rates 15 to 20%, they just raise rates 15 to 20%.
Wow.
And a lot of people, this problem is masked because a lot of people have group insurance. I have individual insurance. I'm an independent contractor insurance agent. And with group insurance, the price is artificially lowered for every member of the group. It's just by design. But the individual pays higher than a group rate. Even though our health is excellent, we were in a different category than a group member. And I just don't think that that's right. And in California, we have a huge part of society that isn't covered by any health care at all. Some of that's by design. I mean, you have some people that were institutionalized, and then when the state decided to get out of the psychiatric care, these people were let go, and they are just wandering homeless people on the streets today. And they seek care, if they ever do, through emergency rooms, which is the most expensive way of providing care. Yeah. Since they don't have any health care program of their own, they're covered by some kind of Medicaid or Medicare. And we as taxpayers pay that cost or subsidize that cost. And as an example, too, hospitals, when they bill for hospital stays, they will charge, I haven't personally been hospitalized, but I've heard this from policyholders, where everything that they use in the room, like a box of Kleenex, they're charged for the full box, and it's not a price that you would be able to buy it at Costco or a Long's drugstore or something like that. It's instead of maybe being $2.50 or $5 a box, it might be $25. And all of this is an inflated price, and they expect you to pay this, and then if you have insurance, then the insurance company negotiates a lower rate. So I don't know many other businesses that would be able to throw out a bill and then have it negotiated and then be able to lower it depending on if you're covered or not. It seems like a price for a health coverage or a certain procedure would be the same whether you're insured or not. It's like fixing a dent on a car or buying a product from the shelf at a store. It would be the same price no matter if you're paying by credit card or check or cash. But that's not the way the healthcare system works. And
so you're telling me that they charge you a certain amount, the healthcare system does, and then they charge way exorbitant amounts, and then the insurance company says, well, we'll pay a little bit of this, and then you have to pay the rest, even though it's still inflated.
And sometimes they can negotiate and the hospital will accept a lower rate based on what the insurance company will provide. But what they a lot of times do is just the hidden charges that are in that $25 box of Kleenex, as an example, that's making up for what they aren't able to collect from people who don't have coverage. So I don't think they're really accountable for how they calculate the premium increase. They just put the premium out there, take it or leave it, and people are feeling fortunate to have coverage because the thought of not having coverage is worse than, like in my example, $831 a month. Even though it's 20% higher than what it was a year ago, I feel fortunate to have it. But how many more years of 20% more increase in cost of a bigger number? It's not just the same dollar increase every year. It's 20% or so of a bigger figure every year. And you get to a point, especially when you're near retirement, where you can't continue to go on and make that kind of contribution. So something's wrong with the system. It's broke, and they're on a rapid building phase right now. Lots of new hospitals opening up. So I feel that my extra 20% is going to pay for hospitals out of my area, as an example. I believe they're supposed to be a nonprofit organization, but I can't imagine that they're not making a profit. But again, there's no State Department that oversees their rate increases like there is with the Department of Insurance for insurance rates. And I think that's what we need today.